Hey everyone, welcome to Weekly Inkblot. I did it this time. Um, uh, this is episode 5, and we are talking about therapies for this one. Which means that Emmy did a lot of research this week. Because, yeah, I don't know all of these therapies. There's like this whole list that I did not know about. I've only done certain ones, so, um, the first one we're going to talk about is what is called psychodynamic therapy. And the reason I want to talk about this one first is because this is the one that when people think of therapy and we show therapy in things like TV shows and movies and things like this is usually what they're doing. This is what people think about is the psychodynamic therapy. It grew out of theories and practice from Freudian psychoanalysis. Um, its behavior is generally like it's believed to be affected by the unconscious and past experiences, and so they really like to explore not only what you're conscious of, but what you might not be conscious of in like certain behaviors that you're doing or ways that you're reacting to things. Um, this is one of the few therapies that they have that is actually open-ended. Most of the other therapies I found out actually have a like they're set into specific guidelines and how long or how many sessions it's supposed to be. And psychodynamic therapy does not do that. Um, that and it's they want you to there's no time limit. They like to deal with the process of like free association, and they just want you to talk about what's on your mind or what you want to talk about. So which I think a lot of people in the mental health realm have dealt with this therapy at one time or another. I think that it's a great therapy for um things that are not like regular depression, and maybe upkeep for like people that are bipolar or people that are borderline personality. Um, I do not think that this is necessarily the right choice for things like post-traumatic stress disorder. Um, and speaking of mental health, Kat, you were so weird. I have this cat. Her name's Daisy, and she hisses at blankets before she needs them. Sorry, just random piece of information. She came up and
She's
hissed.
OCD.
She hissed at the blanket, and it just. So she. Oh hey!
Okay.
I thought maybe you went to bed.
No, I decided to just be tired and do this.
Push through it.
Yeah. So, therapy.
Yes, we are talking about psychodynamic therapy,
Ah.
which is what everybody generally thinks of with therapy. And I was saying that I think that it's a good thing for people like with depression and whatnot. It being more open ended, and they have the choice of what they want to deal with. But I don't think that this is something that this is necessarily one of the right choices for people that have like real acute problems
Ah, okay.
and like
Right, I
PTSD.
agree.
I don't think this is right for something like that.
But it can be useful.
No, it is very useful,
Mm,
and I've gone I've gone through it with
right.
multiple counselors now, and I have learned a lot from it because people on the outside notice things that you don't notice.
Right.
So it's very good for that.
Yes.
Um, so that's the first one. As I said, there's a whole list here. I'm trying to decide how I want to now, and I was thinking it was psychotherapy that was going to be the one that is the one that everyone thought of. And then I learned as I was going through it, psychodynamic therapy is what's considered for the individual,
Mm.
whereas psychotherapy is considered for the therapist and their family, or like couples counseling as psychotherapy.
Okay.
And that's I've only been in like one of those, and
Mm.
it wasn't that helpful. But then the people weren't that open to changing. Along with that tends to come, and I think that this is something that everyone should do in a way. Um, Something called psychoeducation, which is generally is used in like family therapies. It focuses on teaching the family about the illness
Oh,
and like what to expect, and it's
that's what I
also
try to do with people.
yeah, it's also about the client teaching their family about their particular case
Right.
and how to react to their stuff.
Oh wow.
And I wrote down a quote because it focuses on patients' strengths and their personal coping skills. And it says, with better knowledge the consumer has of their illness, the better the consumer can live with their condition. I would advise that anyone with a mental illness should start doing the research
Yeah, I
and
would absolutely.
learning up about it and learning up about different therapies like we're doing tonight, and decide which sounds like it's best for you. And you also need to work towards teaching the people in your life what it means to have this illness and whatnot.
Mhm.
um Let me see which one I want to deal with next. um we talked a little bit about exposure therapy last week.
Mhm.
um we talked about what it is for PTSD, which is the prolonged exposure, which is like constant.
Yeah.
General exposure therapy came around in the 1950s, and this is usually used for anxiety cases. Um, Outside of PTSD, if you're dealing with exposure therapy, it's most likely that it's for an anxiety disorder. Um, and this and I've seen they did a show on it a while ago on Animal Planet, that I forget what it was called. But the thought behind it is that constant exposure to what you're afraid of in a controlled and safe setting is a good way to reduce the amount of anxiety you have over it. So I am completely afraid of bugs.
Really.
Like, I hate bugs. Like, if they step over that line into my home, it's might as well be World War III.
Hmm.
They're not getting out alive.
Right.
In this kind of therapy, they would want to have me around, like the, they would probably use things like tarantulas
Oh.
and things like that for this kind of. But it's the belief that the more you're exposed to it and you're not in danger, the less feel in danger when you deal with it later.
Right.
And I don't think any of us have gone through this kind of therapy, so we can't really
No.
give
How much
personal.
more?
Psychodynamic, I think, was what I went through. I didn't
Yeah,
carry through with it, but that's what I went through.
yeah.
I've basically done psychodynamic and DBT
Hmm.
and a little bit of CBT, cognitive behavioral therapy.
Yes. Which we can talk about that one next. This started as a mixture of behavioral therapy and cognitive psychology in the late 70s. This addresses dysfunctional emotions, maladaptive behaviors, and cognitive processes. And cognitive behavioral therapy, it really wants to examine the relationship between thoughts, feelings, and behaviors.
Mm.
Like, what are you thinking? What are you feeling? And then what do you do afterwards or because of it? They believe that by exploring patterns of thinking that lead to self-destructive actions, we can modify our patterns of thinking to improve coping. So,
So it's sort of like learning how to play chess, learning what steps you need to take, what's the result going to be thereafter, all of that. What are the repercussions of every possible
yeah, kind of.
action?
Um, they really deal with the idea of irrational versus rational, um, which we did a little bit in IOP. Um, we have this, and I can scan it in and eventually make it so that everybody else can see what it is. But we had these thought logs, which it starts out with what is the situation, and then you are supposed to look at what are you feeling, and you're supposed to rate that from like 0 to 100%. And what were you thinking, and rating that from 0 to 100%. Then you're supposed to ask yourself, is that the rational response? Like, are there things that prove that my thoughts and my feelings are correct? For instance, I get into a fight with my mother, and I'm sitting there thinking that my mother hates me, and she's not, she doesn't support me, and I'm very depressed and very upset. And the feelings generally, I think some of the people in IOP would say, the feelings aren't necessarily the irrational stuff. It's the thoughts.
Right.
So, do I have proof that my mother doesn't love me? Well, she just made my dinner, and she pays these bills, and she's taking me out to eat tomorrow.
So it's kind of like a pros and cons list.
Kind of, yeah. It's really about looking at, you know, changing the way you think about it. Like, because if you recognize that these ideas are irrational, then you can map out ways. The final step is to map out what would be a better way to deal with this.
Mm-hmm.
Like, what would be better thoughts to put into your head? Like, what would be the rational thoughts that you could think? And so, if it happens again, you can go back to those rational thoughts that you'd written down and change your reaction to it, so that, the next time you get into a fight with your mom, you're not sitting there going like, oh, she hates me. You're sitting there thinking like, okay, well, there's this and this and this.
Shit happens.
Yeah.
But you want to be able to do it like, boop, like normal people.
Mhm. It's like what I
Yeah, it kind of sucks. Like, it's kind of difficult when like you feel like, oh, like a normal quote unquote, you know what I mean?
Yeah.
Like a normal person could like internalize that everything's fine and everything's good, and they could like immediately realize this, but like we have to go through these motions like, okay, here I had to come up with evidence why this person probably doesn't hate me now because I dropped an egg on the floor, you know?
Right. Exactly. That's what it is.
And that's the painful part because I mean, just being around people that are just always kind of like, oh, you're being irrational. It's like, I know I'm being irrational. I'm sorry. I can't, come to these conclusions with the same speed as you can, but.
Yeah, yes, and that's a good point.
Yeah. It makes you feel crazy.
We are very aware later.
Yeah.
I've noticed that what our behaviors or our responses are not the rational direction, and yet when we're in the moment, we can't think about that. We don't realize it until later, and it's like, oh, right, irrational response. And then, so you have to learn otherwise a way to change your thoughts during that time period, and it's a lot of work. It's not easy. Or you have to perfect how you apologize to people later for your irrational
right.
outbursts.
Just as long as when you're
embarrassing.
apologizing, you don't do what I do, which is apologize for everything.
That's what I do.
And I
too.
do mean
Yeah, I do it too.
everything. Because I will apologize for the dumbest things, and it's not even that I don't mean it. I completely mean that I'm sorry. I just, yeah,
You apologize for things that you have no control over and thus shouldn't be sorry for. My friends
exactly.
are always yelling at me for apologizing for things I don't need to apologize for.
Yeah.
If you feel that way, it's not something you're doing on purpose. You're not being a pain in the ass. You don't need to apologize,
Right, like you move and you think you're too close to someone, and so you apologize, and it's like, what'd you do wrong?
Right.
Yeah, and it is important to not because I think that I personally don't think that being that kind of person necessarily means that your apologies don't really mean anything.
Right.
But it is important to try to go in the direction of thinking, okay, well, I shouldn't apologize for something that isn't my fault at all.
Right.
Yeah.
Let me see. Well, since we're on the CBT, I guess we'll go on to the next of the 3-letter ones, which is DBT, which stands for dialectical behavioral therapy. This was from everything I was reading. I think it came around 1993, or at least that's when Dr. Marsha Linehan got published with it. I think it was when she was doing the actual like real testing of it. It was specifically done on women with borderline personality disorder.
Hi.
Yeah. So back then you would have been a prime candidate for her testing this theory out.
Right.
And it started generally with the idea that this was really good for people with BPD, and then eventually it moved towards, hey, this is also really good with people with bipolar. And now, in 2013, we're kind of finally at a place where it's like, oh, this is actually really good for everyone.
Yeah, it's like it can benefit everyone and it can't hurt anyone.
Yeah,
exactly.
And it's good for addicts, too.
Yeah. Oh, very good. The thing I liked about it, I like the things that I learned from it. It wasn't for me because a lot of it is geared towards people that like self harm and whatnot. Well, at least when I went, and I never got into that pretty much just because I'm squeamish. Um, but uh, I felt like a lot of it was like trying to do like kind of damage control, and I wasn't doing anything like super damaging, and like I felt like that was the main focus, and I'm just like, well, I don't really need this so much, and I didn't think I did, but
There
I think
are
that I could have stood to like sit it out a little more, but I got impatient. I was there for over a year,
yeah.
and basically the things that I liked about it, though, were like, for one thing, I learned the biosocial theory about the predisposition to being emotionally sensitive, and then having a trauma occur, that whole thing.
Mhm.
I think I went over that a week or two ago.
Yeah.
And then I liked the idea that I liked the whole thing about. Sorry, I'm really tired.
No, it's fine.
Um, it's not your fault that you are this way, but it is your responsibility to do something about that. And I like the fact that that gave me some, like, I had to face that I had some responsibility over my own actions and how I reacted to it. And
Mhm.
I like the things I learned from it, like distraction. And I mean, like, I also like the fact that it got me very interested in Eastern philosophy, which has been a huge help to me in my life. I was actually at work today. There was a customer who was talking about panic attacks, and so I brought up like, "Hey, have you read it like about Buddhism and Taoism?" And she didn't know what it was, but she was just like, "Oh, like I'm Christian," and I said, "Well, it's really more of a philosophy, and just reading about it can like really help like your panic attacks because just the philosophy of
Yes,
it."
it can.
Yeah. So it's like, I mean, I have adopted it as kind of the religion that I follow. I mean, more than anything, I'm agnostic. But I mean, if there's a religion that I'm into, it's Eastern philosophy,
Mhm.
and because it's saved my life, and well, religions. That's basically a lot of people's reasons for continuing their religions because it helps them when they're in a tight spot. So DBT did that for me because it's basically she developed it as kind of a mix between Western psychological medicine and Eastern philosophies, such as
Mm.
the mindfulness, the wise mind, all that.
Yeah. There's a bunch of different DBT is a mixture of a lot of different things that you are supposed like things for you to learn.
Mhm.
Um in fact, I'm going to show you one of them that is something that they use in this. Dr. Linehan emphasizes that what we need is to learn skills to replace behaviors that do not work and address problems that cause difficulties in how we function. So this is and this is very DBT. When you go into a DBT group, it's very much about teaching non-judgment. Like you are not the person. You can't judge them. And actually, what I like about DBT groups is that you really do walk into it. The IOP that I was in at Summa, um, in Akron, it really is like you. Sometimes it seems kind of silly when people are sitting there like, no, really, these people are completely non-judgmental. Like you could tell them almost anything, and they'll just sit there and understand. And it's like it really is true. Like nobody sits there and like we hear about some of the horrors that might have happened or what you might have done, and it's kind of like, well, we can understand the feelings that got you there.
Mhm.
um I am actually now that we've talked about therapies, I am going to start bringing into play in weekly Inkblot learning some of these skills that DBT and ACT, which will or ACT, it's you're supposed to pronounce it like it is, which we haven't talked about yet. But like some of the things. This is a diary card, a DBT
Oh, the
diary
diary
card.
card. That was
Yes.
another thing I didn't really like about DBT is the focus that, wow, that's a different diary card. Um, the focus that my personal therapist, because with DBT you're supposed to do like you have one-on-one sessions with your personal therapist, and then each week you have the group sessions. It's still like that, right?
I think it depends on where you go.
Okay.
Um,
For
I,
me,
IOP was since it was intensive, we were there 3 hours, 3 times a
yes.
week, and it
Oh,
was
wow.
mostly group sessions.
Okay, I had 1 hour with my one-on-one therapist and 3 hours one time a week with a group.
Mhm.
Um, and I felt that when I would talk to my one-on-one therapist, this was a community mental health, so like it was free, get what you pay for, you know. And my therapist always wanted to just talk about my diary card, and I'm like, okay, but I want to get into the issues that brought me here, like the stuff with
Right.
history and stuff. And she was like, no, let's talk about your diary card, and that's all she ever would talk about. And
See, I don't think you should focus that much. We only went over our diary card once a week.
mhm.
So what the diary card is that of course it shows you here your different days of the weeks. And then you have the different coping skills all down here, and you're supposed to mark every single one you've used that particular day.
Oh, and you have goals on the other side.
Yeah, there are. I know you can't see it that, or maybe it's no, it's up. It's not upside down. This specifically is asking about leisure and fun activities for the week. This is specifically about responsibilities for the week, and then we have 3 goals we want to
Okay.
get done during the week. This was our diary card from Suma, which is adapted from the Dialectical Behavior Therapy Diary by McKay and Wood. Um, so we have this list, and I'm just going to tell you a couple, some of what they are. Like, let's take today. I've had a really bad day. So I have distracted from pain, which generally is just like finding ways to not think about it. They also have dealt with physical pain, which means things like, taking your medications, taking a Tylenol. Um, they have things like stop to self-destructive action. So like if you wanted to cut but you didn't,
Hmm.
that's what that is. There's Wise Mind, which I really want to talk about at length later. But what Wise Mind is it's taking your emotional side and your logical side and meshing them together. Because, when we're in like anxiety attacks and things like that, we are thinking with a purely emotional mind. And then you have the logical mind, which you can use afterwards. And wise mind is supposed to be a mixture of it.
Hmm.
So you're thinking emotionally like, okay, this is really upsetting me, and then you're thinking of otherwise logical ways to stop it from upsetting you, or to take yourself out of the situation, or to calm yourself down. There's also like using coping strategies, connected with higher power, practice relaxation, completed tasks mindfully, which mindfulness is a huge thing in DBT.
Hmm.
What mindfulness means is that you are in the present moment, because a lot of people with mental health forget to just live in the moment. Um, so, like a mindful activity would be like, I'm going to take some time to color this coloring page. You're not thinking about anything but that coloring page, like what your next color is going to be, or what or how hard you're pushing down on the pencil and things like that. You're not worried about the future, and you're not dealing with emotions from the past. So that's what mindfulness is, and I actually think that it's a really good skill to have. Um, so every single day with this, you're supposed to mark it down. And it's actually a good way to kind of remind yourself, like, even if you're only checking off a few things, you still did something today.
Hmm.
You still use the skills. And the more you use it, the more skills you learn, and the more skills you use. over time. So that is extremely important. Um, Now, along with that, a therapy called ACT. I keep calling it ACTN. That's not actually how you're supposed to pronounce it. It's supposed to be pronounced ACT. I had a couple of places online call it acceptance community or something community therapy. But what I have been finding and what my books are showing me, my book smarts, it's called acceptance and commitment therapy. This focuses on your thoughts and emotions, even negative ones. You are supposed to be accepting them instead of trying to change them necessarily. Um, ACT focuses, from what I can tell, it's one of their biggest focuses is dealing with your personal values and what you wish to accomplish. They are like you accept your values as they are, and then commit to working towards them. Is what this therapy really focuses on. This was developed by Stephen C. Hayes, Kelly Wilson, and Kirk Strussel. I hope I pronounced that right. So one of the sites that I was looking at gave some, what are these called, acronyms when you use words? So they have fear and they have ACT. So and this is how they feel it really tells a lot about this kind of therapy. Fusion with your thoughts, evaluation of experience, avoidance of your experience, because one of the things that they were talking about, they want to teach you not to avoid it, because avoidance is what causes things like the anxiety and some of the PTSD symptoms and whatnot, because you're not dealing with it. You're not, you're avoiding it, and that's in this therapy. That's not a good thing. Reason giving for your behavior, and then act itself. Accept your reactions and be present. Choose a valued direction. Take action. So this one I don't have as much experience in, but I do have a book that teaches all three of these three letter ones, like as kind of a comprehensive thing, so that CBT, DBT, and ACT can all work together to better your life. So now another one that I don't know is like almost anything about. I really had to read a lot about this to kind of figure it out. This is a descendant of psychodynamic therapy. This therapy was specifically tailored after the idea of psychodynamic therapy, but it just takes it to a different level. Now this one is time limited. It's generally around 12 to 16 weeks that you would be in this kind of therapy. The therapist.
I'm gonna have a phone call. Hold on.
Okay. The therapist is empathetically engaging the patient and helps the patient feel understood. Presents a clear rationale and treatment ritual. So it's very, I guess, very detailed in how they do it. The relationships are what is the primary concern in IPT. It's in multiple directions. It's the relationship with your therapist is extremely important. your relationship with yourself and your relationship with others. Because, it is interpersonal therapy, which interpersonal is your interpersonal skills are all about other people as well. That is about how you deal with other people. So it makes sense that, this therapy limits the therapists that do this kind of therapy don't tend to talk in a lot of the technical jargon. They like to keep it
Casual.
yeah. This is good for patients who don't want to deal with all of the medical mumbo jumbo, as they called it, because they are specifically meant to give it to you in terms that you understand. So, and this it focuses on the connection between interactions between people and the development of a person's psychiatric symptoms. And that's all I know about this one. So I guess since Ash is off somewhere, I think we'll go to Ellie's favorite right now. Um, uh, yeah, I know. I'm getting a look for that. I'm saying that because she specifically brought it up when I was doing the research this week. And I was wrong. I thought that this was not done anymore. And I am admitting to the world right now. So there you go, Ellie. I'm admitting to the world. I was wrong.
Hey, the more you know.
Ellie is right. But technically we're both wrong.
Yes, because it has changed since it actually was first implemented.
Yes, and what we are talking about is it's called ECT, or electroconvulsive therapy, previously known as electric shock therapy. So,
right?
In movies, and if anybody in the audience has seen this season of American Horror Story, you've seen electroshock therapy multiple times now. This is the therapy that they always show, putting something into the patient's mouth so they will bite down and won't hurt themselves, and they're tied down to a table, and they use electric shock to right into your brain while you're awake and the patient is screaming and whatnot.
I actually have to go.
Okay.
So,
Bye,
I'll catch up with this later, and I'll see you next week.
Okay. Bye.
Bye.
We're going to have to message her later and be like, okay, what happened? But
Oh, I know, right?
it might be a boy thing. I don't know. Which is always a good thing. But anyway, so it has come a long way since then. We are talking, I think what, it was back in the 70s, it was like this bad. But then,
well, before that.
Well,
but I think that was the last time that way, with 70s and 80s.
I don't think so, though, because I don't tell a lot of people this, but when I was around 14, they considered it for me. And we were given like a specific like how it was going to work, and it was that scary. Like, you were awake for it, and this is gonna hurt like hell, but it's supposed to help you. Kind of therapies, and that was in the 2000s when this was done, because I was in and out of the psych ward for the suicidal stuff and whatnot in like 2001.
But yeah, I mean, it's been in place for a very long time.
Yes.
They've been using that, I would say, probably since, like the early 1900s, 1920s they were using it. I don't know how much further back they were using it than that, though.
Yeah, I don't think they were using it in the 1800s.
I
Um,
mean, they were probably using it around the same time they were using an electric chair.
Probably, I would imagine. Or at least that's probably when it started to form. Um,
Yeah.
this this is what electroconvulsive therapy is now. The patient is in a hospital, um, and you are surrounded by multiple types of doctors. You have the anesthesiologist, you have the general kind of doctors, and then you have like your therapist or the person that's dispensing this therapy. I don't know that it would be a psychologist or a psychiatrist. I don't know what kind of degree you need for this. Um,
I would imagine
I think you would at least probably need an MD for this.
yeah, you would need at least a normal um, doctoring degree.
Yeah, I don't think you could get away with just having a psychiatric degree.
I mean, the amount of physical um, treatment being done with this would almost need a normal doctor's watchful eye.
Hmm. So you are surrounded by various doctors. The patient is put under now. So you are not awake for any of it. And what happens is this machine sends an electric shock into your brain, and it causes a seizure that only lasts for at the most 2 minutes. They were saying it's generally around like maybe a minute and a half, um, but it's less than 2 minutes. It doesn't last any longer than that. And what it's supposed to do, what it says is that these seizures it causes an activation of neurons in the brain, and a change in the chemicals, which I guess after I was researching it, like I read it and I was like, oh, I guess I kind of understand that because depression and things like borderline and bipolar, it's bugging me, um, have a lot to do with the chemicals in your brain. So that actually didn't surprise me that much. Now they usually do it unilaterally, which what that means is your brain is two separate sides, and the two separate sides generally deal with different things. And they've shown that you can cut a human's brain in half and the human still functions. Um, it's just that their connection between the two sides doesn't exist anymore. But anyway, so they do it unilaterally, so they only do it to one side of the brain at a time. And if you,
Which is probably a wise idea.
yeah, but they will do it bilaterally. If you're not showing any signs of getting better from it. Um, they say that it generally takes about 4 to 6 of these treatments before you really have significant change. But this is an extremely risky thing. Um, that
Yeah, this isn't something that they normally just recommend off the cuff.
no,
This is usually when everything else has failed hard.
this is for extremely um, severe cases, and you really have to put a lot of thought into um, doing this. It's not recommended for people with any sort of heart, lung, or neurological disorder. And part of the reason for this is because, along with this, you are going under every single time. And being put under anesthetics is dangerous. There's a lot of things that can go wrong. Um, I personally have been put under for 3 procedures now. Yeah, 3. And the last one, uh, I wasn't waking up correctly from it, and I almost died because of that. It wasn't that anything in the surgery had gone wrong. It wasn't anything else. It was the anesthetic.
Yeah, you always take that risk when you're going under. I mean, it
Hmm.
doesn't matter how young or old you are, the doctors always tell you there's a risk.
Yep.
Always.
This is that is actually the big reason that people can die of things as simple as like liposuction
Yeah.
because you're being put under for it, and it's dangerous. Like you could have a bad reaction to it. You could have an allergic reaction, or you can have a reaction like I had the last time where it just you're not coming out of it correctly. Or and there's also the possibility that a lot of people when they're put under throw up, and not if you don't have a tube down there, or you don't have a nurse right there, you can suffocate.
Yeah. You can choke on your own vomit.
Yes. And so the general side effects of this treatment are headaches and muscle pain, which I already have in abundance, so I probably wouldn't even notice it. But there are also the risks of cognitive and memory side effects. Um, so there's two of them that I have specifically written down when it comes to the memory side effects. Um, the first one is sometimes people have after they have it done, they have trouble forming new memories. And I know me personally, I don't know about anybody else, but reading that kind of almost like it made me almost a little panicky thinking about it. Like, holy shit! Like, what would you do if you can't make new memories? Like, how does that work? And
But suppose you keep a detailed diary as much as possible every time you do anything important.
you'd have to.
It's about the only way I could think of to keep that at bay. I mean, so there might be some of our viewers that experience short-term memory loss.
Mm.
And if that's the case, please feel free to write us to tell us how you cope with something like that, because I'd really love to know
Yeah,
how somebody can get through their day that way.
I'm actually really interested in that too because that is an extremely interesting but depressing thing. I think that would be like really difficult. Generally, this one though, luckily, um, will wear off. They say it takes a few days to a week after treatment is stopped for your memory to kind of go back to normal. So,
Yeah, but that's after treatment stop. That's not even including all of the treatment, the time that you spent in
yeah,
treatment.
the time in between treatment.
So, I mean, that could be months.
Which I didn't even think about this, but it didn't actually say how long it goes in between each treatment. Because as I said, it takes about 4 to 6 of these treatments for you to see any significant change.
And Lord only knows how many after that, if they need to keep going.
Yeah, it's an interesting thought, and I didn't even think about that.
I mean, if you're having what, one a week, at least that's 6 weeks. If you're having one a week plus a week's recovery, that's up to 12 weeks.
Mhm.
That's like 3 months of short-term memory loss.
Yeah,
That's incredible when you start to add it up, and that's just the average. That's not even going into what if they have to go farther
yeah.
with it.
And I don't even know how like I don't. I would imagine that they would probably have to have a general like cutoff of like, okay, we've done like how many of these treatments and it's not doing anything, we need to stop.
But yeah, because I mean, it's controlled seizures, and
Right.
anybody who has epilepsy will tell you what a strain that is on your body.
hmm Which
Um,
is, again, why people with heart, lung, or neurological disorders shouldn't are not candidates for this.
no,
Um, it's generally not a good idea. It because a seizure can, I mean, does a lot to your heart's working kind of overtime to deal with it, and there are a lot of medical side effects that come with having seizures
yeah,
that you know and I can only imagine seizure after seizure it's going to get worse.
well, yeah, because I mean, you're during controlled seizures, your muscles seize,
hmm
and you're in pain all the time. Your jaw clenches. You can crack bones in your jaw or your teeth. I mean, there's all sorts of things that come along with that. And again, you're also under anesthesia, so there can be vomiting, which normally accompanies an awful lot of types of seizures.
yes.
And that's a very dangerous thing if it's not cared for properly. I mean, the original electroshock therapy was incredibly dangerous, and while they
Yeah.
have improved it, it makes you wonder if the risks are really worth it in
Now,
the long run.
I of course am not going to discount anyone that has gone through this therapy that it has helped because that's awesome. Um,
And hey, more power to you, because I sure as hell wouldn't have the guts to do it.
yeah. I mean, if you have gone through it and it has helped you, that's great. And part of the reason why I decided to actually look it up and put it in here is because I am talking about the therapies that are possible, and I'm not saying that this isn't a viable option. I think that it needs to be carefully thought of, though. The second type of memory problem that can happen is people who go through these procedures um, aren't able to recall memories of the past before the procedures started. And this one, they said it can improve after treatment, but it's not guaranteed. Um, which I mean makes sense. You know, if you screw up the chemical and or electrical way the brain retrieves information, of course you know it. Eventually, certain memories are going to be gone.
Well, and from what I understand, both sides of your brain control, one controls long-term memory, one controls short-term memory, and my guess is those side effects depend on what side of your brain was affected.
Yes, that makes sense too. Um, so if you're doing bilateral, that's that's a scary position to be in. Because you know it could affect both. I don't know if the two memory problems ever happen together.
Maybe something we want to look into. And again, if any of you
Yeah.
viewers have ever experienced that, please let us know. We would love to hear your story and how
hmm
you recovered from that. Because we would love to maybe bring up some of your stories with your permission to let other people know that if they've gone through this, this is
Yep.
how you guys dealt with it.
Teach others. So so yeah, it still exists, and it's just done differently. Um,
Still a little scary. Not as scary as it used to be, but still kind of scary.
yes. Um,
And hopefully far more effective than it used to be.
hopefully. I mean, they said it can be pretty effective. Um,
I mean,
but
because
this is one of those things where it's otherwise it's that bad or you've kind of have exhausted all other options.
Yeah.
And I actually, I would love to say, speaking of exhausting all other options, and go on to this next one, but I wanted to actually leave this therapy for last, so I'm going to go to the next one. Dual diagnosis and integrated treatment. Um, what this means is it is treating co-occurring disorders. And in most of the stuff I was reading, what this therapy is actually all about is those with mental illness and a substance addiction. So, and this kind of works with, from what I gathered, it kind of, I think it's for most substances. So, like, say you're addicted to heroin, or you were addicted to cocaine, or you were addicted to meth, or alcohol, or even painkillers.
Yeah.
This is a therapy that they would use for those who the the substance addiction and the mental illness are both really bad. What this does is they believe that it's all about treating, um, helping people recover from both issues at the same time. What they believe is that a lot of these conditions go together, and you can't just treat it one at a time. You have to do something that's going to help all of it. And
There is something I would like to bring up about dual diagnosis. And this was actually something my mom and I discovered um, while looking up possible treatments for my younger sister. There are some dual diagnoses where the treatments are completely counterintuitive
really,
to each other. Yes, in fact, the way that they treat meth and the way that they treat borderline personality disorder, one will negatively affect the other.
really,
And it has to be dealt with very carefully. Like, they say that fluoxetine is great. It is probably the closest thing medication-wise to help with both of those. But other than that, there are some combinations that are very hard for them to appropriately work with because of the nature
of addiction.
of the addiction
Yeah,
or the nature of the mental illness.
which makes a lot of sense. I know that the people I know that have dealt with both at the same time. One of them, he stays away from most medications. He has like the medications that they are prescribing him for like the mental illness itself and some of his physical stuff, but like he doesn't generally he doesn't take over the counter. He doesn't take um anything with alcohol in it. He he kind of he's limiting himself to that, focusing more on the other therapies like DBT and trauma therapy is I think hit the direction he's going in, and that's because all these medications, unfortunately, like when you have a substance addiction, especially if you have something like painkillers, or you've used other prescription medications that you've abused.
Sleep aids are a big one.
Yes.
Cough syrup, that's another really big one.
Yeah, you unfortunately, for a long, probably the rest of your life, you have to be really careful about what you take, because certain things that you wouldn't even realize could have an addictive quality could. And like over-the-counter medication, Emily was saying in group one day, she was warning about the use of some of the over-the-counter stuff because what can happen sometimes is because you have a different tolerance in and how you react to the medication. And some people, for some medication, especially like cold medication and headache medication, I found out actually antihistamines.
Oh, yeah.
Antihistamines is a big one. Some people, when they take it and it doesn't happen with everyone else, um, sorry, I don't mean to laugh. This really isn't funny. My cat did something silly. Um, they get a like almost a high off of it. They get like a buzzed feeling, like this feeling of like, hey, everything is awesome.
Well,
And they
yeah.
start overusing it because they don't think, like, well, it's an over the counter and it's just an antihistamine. It's not going to have like any addictive properties. This should be fine, and that's actually not true.
Oh, yeah, that's how they make meth. Is they
Yes.
get cough syrup and just cough medicine in general with antihistamines in it. It's one of the main ingredients for not even only meth. I think there's several synthetic drugs that do use it that people can make at home. And I believe what an overdose on cough syrup is called robo-tripping.
Is it?
I think that's what it's called.
I I'm like so out of the realm of like the drug area. Like I've never done any sort of like real illegal drug, and I've never shown any addictive tendencies or anything.
Yeah,
Like and you have to be careful on psych medications. Like I take Ativan, which is a benzodiazepine, and generally you should stay away from benzodiazepines. They have addictive qualities, and the more you use, the harder it is to get off them because you have a lot of like extreme physical symptoms. I've seen people who have gotten off Ativan who just from like 5 milligrams, their arms are shooting up without them meaning to. They're having body tremors. But I do have a lot of like severe anxiety problems, and because I've shown no addictive signs and I've never abused it and I've never been on like that high of a dose of it, um, I'm fine to be on it. But like you really do have to think about it and be careful. And
yeah. Lithium's another one that you have to
yes,
be careful with. And again, it's one of those medicines that you have to have regulated by the proper kind of doctor.
every medication
Yeah,
needs to be regulated by the right doctor, and especially anything that is under psychiatric medication, um,
yeah,
antidepressants, antipsychotics, anti-anxiety, that needs to be watched carefully. My doctor, he in all of his things, he admits no refills, and you have to see him for every single refill you get. So
yeah,
the longest you can go is 3 months in between seeing them if you want to continue on your medication because of all the things that can go wrong.
yeah. Because there's some medications, I'm sure Emmy has some of these medications. I know lithium does. You're supposed to get regular liver panels, certain organ panels done on you regularly for them
Yeah.
to monitor what it's doing to your body.
hmm I'm not on like none of the. I don't know that any of my past ones have been ones that I should do that. I know for certain right now the ones that I'm on, that's not a problem. But he is admitting that things can change medically, and he's not just going to dole out the all of the refills if you are not seeing him regularly, because I think part of it's because he can be held liable for it. But
Yeah.
I think actually with him it's actually more because he really just doesn't want anything to go wrong. Um, but
Yeah, he can actually be held liable for that, I
oh,
think.
definitely, yeah. Over prescribing and allowing refills to addictive medications, the doctors can be held liable, and they can lose their licenses, and so they do have to be careful. Um,
And don't think you people who take Excedrin or any sort of headache medication is exempt.
no, it's not.
Those actually do affect your kidneys.
Hmm.
So if you're taking them a lot for chronic migraines,
So can Tylenol.
yeah, and Tylenol, I would highly
And
suggest that you get regular blood work done.
if you're using a lot of things like Advil and Aleve, you it's not the kidneys, but you should be watching your livers
Yeah.
for any sort of like changes. And I don't know if that's true of um
Um,
what's the other pain medication over the counter that I'm thinking of that
well, the Excedrin has acetaminophen in it.
right,
And
which is
that's
Tylenol.
Tylenol, which is why you need to check your kidneys.
Yes.
There's Advil, which you need to check your liver for.
Yeah, but Advil and Aleve have a specific painkiller in it that
I know, and I
I
can't.
can't think of the word. Ash, what is the Asher?
Hold on, I might be
See,
able to check.
he's not even listening to me. Asher. What is the painkiller that you used like when like that you had
That
at
Aleve uses.
home that relieves pain? It's just a general over the counter one. Yes, I think that's it.
Ibuprofen.
Ibuprofen, that's what I was thinking of. But anyway, um this therapy um is very it's much bigger than just treating like the mental illness and the substance addiction. It this therapy, um when you're in this type of program, they deal with almost everything to help you. I mean, as much as they can, obviously, but they're watching everything. You know, this includes assertive outreach, job and housing assistance, family counseling, money management, relationship management. I mean, they want to be able to help in every single thing that they can in order to for you to succeed. This program is how it works. I didn't see anything about it giving a specific timeline for this. I think this is one of those treatments where it's more, um,
Maintenance.
yeah, you have to you're in it for a while. I think because unfortunately addiction is so difficult.
You are always recovering from addiction. Always.
Yes.
Nobody ever says they're an ex-alcoholic. They're always a recovering alcoholic because once you're
Mm.
addicted to it, you're always addicted to it. And, you know, if you're an alcoholic, one drink can send you spiraling right back into it.
Yep. And it's and I was told by someone that some people um don't it's called like acute um something. I don't remember the word. But what happens is you start into recovery, right? And somewhere down the line in recovery, sometimes it's immediate, but sometimes it's not. You start having real horrible physical symptoms of the withdrawal, and
DTs.
hmm?
I think the old term for it was DTs.
Yes, that is the old term. There's a new term, and that's the one that I don't remember. Um, but apparently, because well, DTs, unfortunately, it's not a good word because that's they were specifically thinking of like your when you're detoxing off of it. But I actually found out that apparently these symptoms can come up at any time for a very long time. Like you could be off of whatever substance it is that you're addicted to, and months later, like even 6 months later, you can start having the headaches and the body aches and all of that, the hallucinations and everything. And it makes it really, really hard for addicts to not go back to the medication just to make it stop.
Yeah.
And they are so, this treatment, dual diagnosis and integrated treatment, I think it's a long-term thing because of that issue and because addiction is so difficult. And one of the big things they really focus on is social support. Um, for Because most of the time, you really need that social support in order to beat your addiction. Because sometimes, I I don't want to say that we don't have the strength for it, because I think that the human psyche is actually pretty is actually pretty I just lost my train of thought. I'm sorry. Um, we're talking about timing issues. It's hard for us to sometimes to do things on our own, especially um, things like getting over addiction. It really is important for you to have the social support, and this treatment focuses a lot on that social support because of how critical it is. Um, but I think that we have definitely talked way too much about this. We will be doing a group of weeks. I don't want to do it just one week because I feel like addiction is such a huge problem that we really should.
There's so many things.
Yeah, we really need a couple of weeks to deal with this. I think that when we do it, it's not necessarily going to be consecutive. Eventually, we're going to have a couple of people in here that are recovering
Hmm.
from addiction, and we will be doing a panel for family of those with addiction, because that is very hard and you need to be very integrated into it. So we will be doing that later. We got a little off topic, I admit, but it's hard. It's hard in this kind of thing. It's hard not to. The last one I have written down is the most recent. Um, and I actually hadn't heard about this before. The shortened version is called TMS, but it's called transcranial magnetic stimulation. And this the device that the FDA has actually approved is called Neurostar, like neurological, like, so Neurostar is what the device is called. It was cleared by the FDA in 2008. As of right now, the FDA only approves this treatment for what is called uh, tr- treatment resistant depression. And this is really, really specific. I was reading what they have to do in order to get you to this point. Like, this really is your last ditch effort. Um, you have to have failed at least 5 different attempts at curing your depression before this is even thought about. And if you come to them and say that you have not tried any sort of medication, they will turn you away, because that is a viable option for depression, and they will say no until you have gone through all the medications and none of it has helped. Um, then come to us. And treatment resistant depression, like, we don't hear about it a lot, but it is a problem. Um, One of my counselors have mentioned that they think that mine's like that because, despite all the different medications I've taken for it, um, it's not a problem that's really actually like going away or being, despite what, a decade in treatment, I'm still having a lot of acute symptoms and episodes, and so you'd need to have tried a lot of like different things before this. You'll need to have tried like the psychodynamic therapy. You'll need to have tried medication. You'll need to have tried things like CBT, DBT, ACT. When all of this shit doesn't work, that's the only time they do this. So what this device does is you go in and your session is usually about 40 minutes long. And according to this, they usually do it daily. So you're in there for 40 minutes every single day for a 4 to 6 week period. And what this does is the device sends a magnetic pulse to the frontal left side of the brain, which then generates electrical currents in the brain. Now, the frontal left side of the brain, is it? No, this is the left side.
Yep.
Oh,
Mine's mirrored.
yours. Oh, okay, I get it. Yours is mirrored.
Yeah.
That's why I was like, wait, you're not pointing to the same one.
But no, I swear I know which side's my left side. I am not that dingy.
Did you notice I had to look at my hands to figure out which was the left side? If I don't have my wedding ring on, I don't know which side's my left side. I have to physically start writing in the air, and then it's like,
I have a
right.
mouse in my right hand. That's the only reason I remember.
I didn't even think about that. I always check my hands. My mom does that too. It drives my my stepdad crazy. But so the left side of the brain is in the frontal left side of the brain is very specific. It apparently that area in those with depressions, especially those with treatment resistant, but this is true for all depression. That area of the brain is actually not as active as it is in everyone else. So what this is doing is it's sending the electrical currents in, and these resulting electrical currents activate the neurotransmitters, which that are specifically implicated with symptoms of depression. So we're talking about things like serotonin, norepinephrine, and dopamine. And what this is saying is that the frontal left side of your brain, which deals with these three, they're not as active, and you're not creating as much of them, or your receptors for them are not picking them up. Like, I don't want to say damaged because that's not really the right word.
And this can be caused by a plethora of things. This could be just a normal chemical imbalance, and this could be long-term drug or alcohol abuse,
or long-term abuse and trauma and situations.
There's a plethora of reasons why this is not functioning the way it should.
Yes, there are, and which is I personally feel that those who go through a constant state of trauma and abuse, um, it does change the chemicals in your brain. And
Yeah.
what this is truth. This is truth. It does change the chemicals in your brain because the chemicals that you get during abuse and trauma are different. And what my personal opinion is that the constant being in that state will eventually change the chemical makeup of your brain forever. And that's where I am. I went from having normal depression due to a situation, and because the situation continued over and over and over and over again for many years, um, I will never, probably, there will never, probably never be a time when I will not be taking some sort of antidepressant. And I've come to terms with that. Like it actually doesn't bother me anymore because like years ago, I realized that I would be on this medication for the rest of my life. And it's not that I had done anything wrong, and it's not that it's something that I can change, because you can't really change the chemical makeup of your brain, especially once it's been altered like this. Um, and really, the most common side effect for this therapy is headaches. And beyond that, I didn't really see. I know my
A lot
mom.
of
Yeah, I know my mom had been making comments about how they were doing surgeries now for depression. I don't think that this is what this is though, because based on the fact that you're in there every single day,
yeah,
tells me.
they wouldn't do surgeries every single.
Yeah, I don't think that it's anything that's put into your brain. I think that they're using things like sticking things onto your head. And I know that there's this cap which I was going to research this, but I couldn't really find a lot behind it. It's called a therapy called CNS, where they put this cap on you, and what it does is it measures your brain waves, and it by looking at your brain waves, they can get a better idea of what medication might work for you. Um, but it's very very new. Um, I will reluctantly, because I don't like Fox News and I don't want to get into politics about this. But it was Fox News that was talking about it. But I will post it on the Facebook page, because I thought this was really kind of interesting. Because there's a lot of guesswork in medication, which I guess we should really bring up is a viable therapy option too. But medication is not a therapy that you should do alone.
No, it should really be used to
If you,
assist.
yeah, if you're going to do medication, one of these other therapies needs to be part of it, if
Yeah.
you ask me. DBT is a great one. The psychodynamic is really great if you don't have acute problems to deal with. I think a lot of these are really good. And you can intermix a lot, which is wonderful.
Yeah.
Because
Well, and particularly with that DBT. DBT
Yeah.
seems to integrate really well with a variety of all the other therapies
yes,
that you can
it does. DBT is one that they like to use in together with other therapies because it is so helpful, and DBT really is about skills. And as I said, I'm going to start bringing in skills into our sessions because and eventually we're going to talk about different things that go along with for instance, when we deal with we will talk about anger issues and how that works, and what they do when you do like anger management and things like that. But there are specific DBT skills that go along with anger management. So when we deal with that, I will bring up anger. I will bring those skills in, and there are a lot of skills to use, and that's awesome because what doesn't work for you could work for someone else, and what doesn't work for your buddy
Doesn't mean it won't work
could
for
work
you.
for you.
Yeah.
And like meditation is a really good one. We use that a lot in the IOP, and meditation and mindful breathing and things like that. Not everyone's the same. Some people get a lot out of the people that talk you through it. Some people don't like that, and zone out during that time. Some people like the music. Some people like to just concentrate on breathing. But it's all the same thing technically. It's just how you do it. And the DBT skills really go around that as well. Like there's different ways to use them. Um, but yeah, I'll post the link to the video for the CNS because I what the cap does is oh, I said it. Yeah, it looks at the brain waves, and because it is a lot of guesswork with medication, and I guess what this particular therapy is doing is taking some of the guesswork out of that, because it's looking at where the problem areas are and what your reactions are and like what the brain is transmitting during that time. It's like a 20-minute session. What as they were saying, it's about 500 to $600 though, somewhere in that ballpark. And unfortunately, right now, insurance does not cover it. But the guy in the video was saying that United Healthcare is actually looking it over as a viable option for doctors to use. And the guy that was talking about it was actually he was thinking that United Healthcare might be picking it up soon to start covering it, like at least part of it. And so as more things come up, I will the Facebook page right now. We talk about the weekly things, but I'm also trying to post things from different groups that are giving us different articles, like Psychology Today. Um, there, there's a couple of pages on Facebook and that have their own sites as well, that are working towards outreach as well, and they post articles, and so I'm trying to give as much as we can. So like the Facebook page and be watching it for different articles, because I am trying to post a variety of different things. Um, So those are all the therapies I had written down. Oh, the other one is support groups, and I didn't do a lot of research on this because I've been in them, and each support group's a little bit different.
And we might get into that more when we start getting closer to our addiction series, because an awful lot of support groups is essential for addiction recovery.
Yes, it is.
It's essential for a lot of things, really. I mean, and it works for some people. Sometimes they don't work at all, and it depends on how you yourself work.
Some people don't take well to group therapy or support groups, but others do. Like I would have thought that with my social phobia, I wouldn't have liked it, but I actually really like the setting because usually group therapy is small and intimate, and the more you go to the meetings, the more you know the people. And some of the support groups, like, you have to actually be on their list to get on. Like I joined a pelvic pain support group um, that was only for women because of of things like vaginal pain and whatnot. Um, and you had to be on the list in order to be in the therapy, and she only wanted around, I think, 6 people, 6 to 7 people total. She didn't want it getting any bigger than that. And so some of them, like some of the 12-step programs and things like AA and NA, those can get bigger, and people are in and out
It is
a
also
lot sometimes, but
important to understand that things like NA and 12-step programs, they're set up very specifically.
mm,
There is, because an awful lot of them are run by individuals, as opposed to a lot of them are run by, there are licensed doctors involved, but the vast majority of it, you're just talking with your peers.
Yeah.
So you also have to go into an understanding that you are not there to get medical advice.
mhm.
You are there to talk about your problems. Medical advice is
A doctor thing.
Yeah.
Keep that with your doctor.
do not get psychological medical advice from support groups.
In
for
fact,
most normal steps.
generally the rule in all of the support groups I've been in, and I think I've gone through 4 different kinds now. Um, the general rule is you don't give advice.
Yeah.
Because
You don't give advice, you listen.
people you have the chance of getting into trouble with your fellow peers if you give advice, because like say you give advice and someone goes and uses it and it doesn't work for them, and then they're like, well, you told me to do this and it didn't work and now it's your fault that this is all screwed up. So that's one direction you don't want to go, but you also don't want to limit their options. Generally the rule of thumb for support groups is if you're going to talk about what they could do, you should be talking about what worked for you. Like you should be talking about personal experiences, like, well, when I was on this or when I was doing this, this is what calmed me down.
Yeah, personal experiences and generalities are a good thing in support groups.
Yeah, but also remember that as with any therapy, you have to continue to go to it to get anything out of it. And support groups, especially like when you're in a group setting, the first couple of times it's going to be really scary and really stressful. But the more you go, the more comfortable you will get with people, and the more comfortable you'll be in that group setting. And I'm not saying that some people really don't do well in group settings, in which case, we did give you a plethora of on your own therapies. But I think it should be said that group therapy can be amazing and can work so well.
Sometimes it's just a matter of finding the right one.
Mhm.
So if the first one doesn't necessarily work out for you, don't completely discredit it.
Yeah.
It
Try
may
it.
just take moving doctors. It could just mean, waiting a little bit longer till there's a new fresh group.
Mhm.
There's so many different options available that you should never just straight give up on something if it
Yeah,
doesn't work.
and there are generally so many different types, especially with like 12-step programs and things like NA and AA. If you don't like the meeting, go to a different one.
Yeah.
One of my friends does not like the how religious some of the 12-step programs can be.
And most of them are, because, especially in cases where you've gone to prison or jail because of an addiction, they use God, because a lot, again, and this was mentioned earlier, a lot of people use religion to help as a coping mechanism, and they do often try to incorporate that into a lot of the 12-step programs.
Yes, they do. And so while you will have a lot of those groups that might go in a like a Christian direction, if you look hard enough, you will find groups that won't go that direction. I know there's one up in near Kent or Ravenna. I don't remember which. That is a agnostic group. So they do deal with like some of the ideas behind it and like God in it, but they don't do like prayers at meetings. They don't really kind of push it down your throat. And
It
so
is also important to remember that while you may not like the religious aspects, the message is still there and still important
and it's still valid.
and still valid. And there are an awful lot of support groups that, while yes, they're very religious, are not going to force you to do anything you're uncomfortable with.
And you don't have to with support groups as well. Say you're addicted to alcohol, you don't have to stick with it with AA. You I know a lot of people that have been alcoholics that go to NA
Yeah.
or go to Al-Anon, which is generally for the families of those who
Mhm.
have an addiction. And I know that it's usually alcohol, but they do the Al-Anon meetings for other substances as well.
They have Nar-Anon for regular narcotics
Do
too.
they?
Mhm.
Yeah, and then I know a lot of people
Families
that
of narcotics.
were addicted to painkillers that go to NA or go to AA meetings. And so it's not you don't have to go just based on what it is. It's really about finding a group that works for you.
Yeah, the message is pretty much the same across the board for a
Yeah,
lot of 12-step programs.
generally it is.
You're really, if you're picking NA, you go into it with the mindset that the people that you're talking to, the majority of them have been through like drug abuse, narcotics.
Mm.
If you're going to Al-Anon, the majority of them have experience with alcoholic tendencies. So when you're talking to them, a lot of those are the majority of the stories that you're going to hear. But it doesn't mean that what you have to talk about or say is any less valid. If all you have in your area is AA, which is the case in a great deal of Northeast Ohio, in particular, take the chance and go to AA. If you have a narcotics problem, just go to AA.
Yeah, or there's a lot of different groups that you can find. Look up support groups in your area. Talk to different doctors about support groups that they know about. Um, and this is true for all different kinds of conditions, not just mental illness.
Yeah.
This is for physical illnesses as well. Generally, you can find something in your area, and if you really don't, if there's really not something in your area,
There are
um,
online forums for
there's
that.
online forums, there's online groups. Um,
In fact, if I can find the one that I had joined when my sister started with the meth, I will post it for everybody because it has an entire list of like NA, SA, CODA, um,
mhm.
all of it, fibro, depression. It's an entire list of different forums you can um, talk to other people via the internet um, about what's going on, and it still follows the 12-step program.
Mhm.
Everything is still exactly the same kind of rule structure that is in 12-step. It really helps for people that, again, don't have really any options in their area or who maybe have a lot of social anxiety problems. Um, it's perfect. And it's really inspiring to see some of the people's stories written on the website. And again, you can remain completely anonymous
Mhm.
and talk to other people. And they do have a sponsoring system, much like any other 12-step program would. So if I can find it, I will definitely put that up on the Facebook page for you
Mhm.
guys to take a look at because it's well worth the look. I mean, you don't get the exact, physical human contact that you would in a room, but it's better than nothing.
Hmm.
So it's a good option.
And some groups are free, some are not. Some are covered by insurance, and others are not. It depends on what the support group is, and who it's being done by. If it's done by doctors, then there's generally some sort of payment, whether it be through insurance or through you. But like the ones that are run by people that have the same problems, those ones are usually free.
Yeah, the
Um,
12-step programs, nine times
12
out
step
of 10,
programs are free.
are free.
Um,
They're always free.
sometimes they can ask for donations, but they can never force you to do anything. So
Yeah.
those are free. There's nothing about that. But yeah, if you have a question about a therapy, or you are in one of the therapies and we said something wrong, which is totally an option. Like, trust me.
And
Like,
we apologize because
yeah, I don't know as
no.
many some of these as well. Like, I really had to do a lot of research to figure it out. Um,
And
but
we are not licensed doctors.
No, we're not, and we're not experts on this. Um,
So do not ever take us completely 100% by our word.
no, yeah, do your research, ask your doctor, all that kind of great crap, and all the things that keep us from being liable. Um,
Yeah.
but that's all on therapies. This is this is gonna be one of those times where I'm gonna be sitting there like, oh crap, what should we be doing next week?
Next week, I think we're going to start talking a little bit more about DBT mindfulness and meditation techniques. Since we have started since we've covered the majority of the therapies, I think we will start going a little bit more into some of the techniques that you can use to cope a little bit.
And as I said, even after that one, I'm gonna be bringing in like DBT and ACT and those kind of skills in a lot. So yeah, I guess we can go in that direction.
And then probably after that, we might start moving to borderline personality disorder and bipolar. Um,
And things like that. Because I do want to, and then hopefully, I don't know when we're going to do this. I need to talk to the people that want to be involved. Um, but we are going to be doing a panel that's going to be a lot bigger than just like the two or three of us, where we're going to have family of those with some of these disorders and whatnot, talking about their side of it. And I think it's really important because I feel like recovery isn't it's not a one person thing. There's a lot that you can do, but there's a lot that other people can do too.
yeah, the most important thing about recovery, and this is important for everybody to remember, as much as it may feel like it sometimes, you are never alone.
Hmm.
There is somebody somewhere, be that somebody you don't know, somebody that you do know, somebody that you're not even thinking about, that does care.
Hmm.
And it's important to understand that whether or not you realize it, you have a support system, and the things that you do affect people.
In fact, I think that as a precursor to the family one, next week we will talk a little bit more about the DBT skills, but I think next week we're also going to talk about the importance of your social support, and the misconceptions that we have about our social networks. Because those with mental illness, we do have a lot of misconceptions about how our support systems work.
Yeah, I'll
And
be the first one to admit, I never know until, the worst happens, just how many people care.
Mhm.
And,
and how many people are willing to listen.
Yeah.
But So we will talk about that next time because I think that that's really important, and that's
Really
actually,
is.
I think we need to address that one before we do the family group, but also before um, we go into a lot of the rest of it because it's important to remember that your social support's very important.
We also might want to cover suicide prevention for that, because it is also that's
That's
one of
all. Yeah,
those.
that's a social. That's also a social sport.
So
Um,
next week is gonna it's gonna be kind of fun to have the techniques, but it's gonna be kind of serious, and I do think it's important that we have those techniques in place for the more serious stuff.
yeah.
Um, so yeah, next week it'll be mostly about your social support system, suicide prevention. Those are
Yes.
gonna be
Those.
really big ones for next
That's
week.
what we're gonna do next week. So now you've seen us brainstorm on camera. Hope to hear from you guys. Hope you guys are enjoying it. I mean, well, maybe not enjoying it, but at least learning something from it.
Right.
And remember, you're not alone. And if you guys need anything, have questions, have comments, get back to us. I will be happy to have us answer them. I will be happy to bring them up on air or bring them up on the Facebook page or on
You
the
so
YouTube page.
choose,
Yep,
we're never going to use your name without your permission, and we're never going to use
yep.
your story without permission. So don't ever worry about that. We won't ever do that to you. So
So, uh, see you guys next week.